Hello, everybody, and welcome to Dentistry Unmasked. I'm Dr. Pam Maragliano-Muniz, Chief Editor for Dental Economics, and with me, as always,
Hey, Dr. Pam, David Rice, Chief Editor on the Dentistry IQ side. How's your day?
oh my gosh, my day is wonderful. I love that the sun's out, weather's good, like life's good. And we have a very interesting guest with us this week.
Whoa,
We
what?
do.
Don't put too much pressure on me to be interesting.
You're like, whoa, 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 whoa,
Wait
wait.
a
What do
second.
you
No one
mean
said I
by
would be
interesting?
interesting.
Don't oversell me out the gate.
Dr. James Younger, welcome.
Thank you. I'm so thrilled to have been invited on. Big fan and just a pleasure to speak to both of you today.
I'm so happy to have you on here. So, you have an interesting, I guess you want to call it a trajectory, a different path that you've taken with your career. Tell us about it. I'm excited.
Yeah, I mean, just to give you the quick background, I've been a practicing dentist for 25 years. I graduated from the University of Toronto back in '99. Did a little bit of associateship after that. Before diving into anything to do with my own practice, I worked for a while at one of Ontario's what they call super jails. And also, there's a mental health center in the same town as that. And I worked at the mental health. So I did some institutional dentistry and for a few years. And then was getting I thought, well, probably want to expand my horizons a little bit. So I started a new general practice from scratch, built that up. And then I acquired a pretty high-end cosmetic dental practice and spent quite a few years doing full mouth reconstructions, implants, full mouth veneers, all of that kind of stuff. And then I got this crazy idea for this thing called Temp Stars. So it really bit me hard. I just couldn't stop thinking about it. I tried to work on it while I was running my practice as well. And I needed more time. And so back in 2015, I sold my practice to pursue Temp Stars. And one of the things people would say is, wow, that was really risky. And to me, it didn't feel risky because I love dentistry and I love owning a dental practice. I love leading a team in a dental office. So my thought was just, well, I'll just go back and happily do that if things fizzle out in these early days, sort of thing. So I knew it's a funny safety net to have, but I knew that I would always just love and could happily retire off into the sunset as a dentist and having a dental practice. So then from there, as Tempstar started to grow, I really got I think I stopped maybe doing clinical dentistry for 3 months at the most before I just had to get back into the operatory. So I started working back in the mental health hospital. I worked back at the jail again to get just to kind of keep my hands in it. And that allowed me to kind of pursue growing Tempstars. And so now as it is, I do dentistry at the mental health hospital. And I also do volunteer dentistry for the homeless to kind of contribute back that way as well.
That's a nice frame for saying you can't stay out of jail.
Yeah, exactly. I
Once you
can't
get
keep my
in, you
hands.
can never get out.
Can't,
Yeah, I
these
can't keep my
just
hands out of people's
the
mouths,
inmates
and I
just
can't get
keep,
out of jail.
cycling back in.
Yeah, exactly. I'm
No, but it's
institutionalized.
interesting because I feel like a lot of people will take, maybe like a FQHC role or an institution job and then sort of be like, okay, I did that. I got all the experience because obviously it tends to be a faster pace or a different, like a different cadence than you'd have in private practice. And then people kind of move on to private practice, but you sort of private practice, jail, mental health institution, back to private practice, and here you're kind of going full circle again. What would make you go from private practice over to a jail mental health setting? Because it sounds to me like that's much harder.
it it's harder in one way and maybe easier in another way. And I would say that when I first graduated and I was working different associateships, I was working, a few different ones and with more and less busy schedules and things like that. And of course, trying to grow a patient base as an associate and things like that. And to be honest, the opportunities for the institutions just fell in my lap because the where I was associating happened to be within striking distance of the hospital and the jail. And so I kind of got offered it. They said, "Oh, do you know of anybody who might be interested?" And at that time, I was still kind of building up my patient base as an associate and things like that. But it just seemed a way to say, well, have a really regular full-time work as a dentist and at the same time take a little break from growing up a patient base and things like that. It had never been my intent to do it long-term and permanently, but at the time when you've got some student debts to pay and things like that, and you want a consistent income to start growing your life, that worked out well as well. And it was certainly a fast-paced environment to build up my clinical skills in those early years as well.
So you said you were working in a super jail.
Yeah.
So define super jail, because that could be a big jail or that could be maximum security prison where you're dealing with some hard criminals.
Yeah, so the term kind of comes, so as you know, I'm based out of Toronto. So in Ontario, it was Ontario's first what they would call a super jail, meaning it was a brand new facility that had been built large and for high capacity, and in an ideal world, very well organized and things like that. So it was kind of a take at a new type of correctional institution at that time. So everything was brand new. I was the first dentist there. I had to go in and set up all the dental equipment as they were kind of building out the operatories and that sort of thing. So that's kind of what it was. It wasn't that facility, not maximum security. It was called what's called a provincial facility. So the longest sentence there was 2 years less a day. So it was more about capacity and the size of it.
Now, David, you've done some time as well, right?
Why are you bringing that up, Pam?
I just, we're an open book here. We're going to unmask the truth.
I did do some time between my third and fourth years of dental school. I actually I was at a maximum security penitentiary in the beautiful city of Lompoc, California. For all of you who've never been there, it's like this big. There's a jail, there's an Air Force base, and at the time there was like a Motel 6, and that was pretty much the whole town. But a lot of cool experiences, that's for sure.
I would think that a dentist might feel intimidated by working on this clientele. Like, what was your guys' experience?
I'll share mine. I was probably 25 pounds heavier, so I was intimidated going in, and I intentionally like bulked up before I went there, thinking I'm gonna get as big as I can get. But my first day was daunting. I didn't realize. I thought, oh, max prison, people are going to be locked up, and I walked in, and you go through all these like a series of like 4 different security things just to get inside. And I'm like, oh, this is great. It's going to be safe. And then you get inside, it's like a public high school. There's just hundreds of, and I'm going to tell you, huge humans lining these corridors. And at that point, I realized I'm like, this might have been the worst decision I've ever made. It was daunting. But I think what I learned was one of the few people there to help. So it didn't take very long for inmates to see me as someone who was there to help. And thank goodness, like I never really had, an issue. In fact, I had a lot of people who were, pretty friendly for the most part. I saw some things, but no one really nothing. I never felt in danger. How about you?
That kind of echoes mine in that you go in and I have a certain disposition in terms of I never really try to impose anything on anybody, and I wasn't there to tell anybody that they needed to get this work done or anything like that. I was just there to help, and kind of my approach probably helped to minimize any tension or altercation that may have come about. And at the same time, you're right, when you're there to help, and if you are there to help, you build a bit of a reputation, and people don't have to come to the dental office. And so if they're there, they're usually there by choice because they have a problem that they're hoping that you can help with. And I agree, like it was, for the first while, it was a little hard to get used to walking around, and there's just, there's just inmates everywhere, and that's just the normal way it is. And so you do want to make sure, well, I did anyways, to make sure that I was treating people well, so that I was well thought of in the facility and things like that. And I do remember after about a year and a half, somebody came down, a pretty large person, and he was in Hell's Angels. And he said, I just want you to know you're safe here. because if he literally said, he said, if we're going to shank someone here, don't worry, it won't be you. You've got a good name here. And so I thought, all right, well, that's nice, I guess. Thank you.
Yeah.
Yeah.
So did you have the whole intro to working at a prison gig where they showed you 180 ways people make a shank, and then gave you if someone takes you hostage, we don't save you talk?
Yeah. Yeah.
That was a little intimidating.
Yeah, exactly.
What?
Yeah. All on day one, Pam.
Yeah. They don't assure you that if something happens, you'll be okay. They don't worry, you'll be the first person we save.
Yeah. They're like,
Yeah.
we don't negotiate because if we do it for you, we're going to have to do it for everybody. And then they're going to take hostages all the time. I'm like, okay.
I
Yeah.
All
would
right.
be out of there so fast. Like, okay, so why did you stay?
How about you, James?
Well, to be honest, I liked it. I liked the team that I was working with at the time, and I didn't feel unsafe. It took just some getting used to, and even that orientation. You think, okay, well, everybody goes through this, and this is just the way that they run it. But I had confidence in the way that the facility was being run, and what the policies it had in place for inmate movement and things like that. And we certainly had, our personal alarms on us, and as well there was security all around and things like that. And I had a pretty good reputation with, because we were in separate area of the healthcare wing, and so the healthcare wing had its own security detail and things like that. So I had a good reputation with them, and they always made sure that I was safe and taken care of. And they were also able to sometimes identify maybe somebody who shouldn't be coming down. They would come down for the dental office, and they're like, no, not that guy. And so yeah, it was a really, I enjoyed the time. It was really fascinating, and at the same time, you get a high volume of people you can help. And my goodness, people come in with broken teeth and problems they've had for years, but they're in prison, and you help them with a tooth or a problem, and they're equally grateful. They're certainly no less grateful, I found, than anybody that you might treat in the community, and sometimes more so.
So you were able to set up the clinic. Did that include oral hygiene products? I would imagine that whoever's ordering or, kind of whatever they're getting as like a standard issue might not be what we would want for people to have. Like, do they get good stuff?
Not great. Not
Mhm.
did you have access to kind of the oral healthcare products at the facility, David? For did you see what they were using for their own care?
It was super basic. So for us at the time, and this was probably 90, like 1992-ish, it was you did amalgams, you could do composite on an anterior tooth, you did a ton of extractions, and there was a decent amount of just urgent care. So we didn't really have a lot of products to deal with really on our side.
And same here, they had these very small toothbrushes because they could be sharpened into a weapon if they're too large, and then a little bit of toothpaste that I believe was even just dispensed at the time for them to brush their teeth with. Floss, I don't think they had any regular access to floss.
I would imagine. So tell us about your day. I know we got to talk offline beforehand, and your schedule is no joke. It is not for the week.
It was yeah, it was nicely fast paced. We had a really good groove going, and certainly the efficiency wasn't there at the beginning, but we had such a huge backlog. We had to figure out an efficient way to get people good quality care while at the same time being efficient about it. And so our backlog would be hundreds of patients long, and every day we would just kind of take the next 30 people and get them on the list and work through it for the day. I worked longer shifts, sometimes 12 or 14 hours sort of thing, there. And yeah, it was just in, and we just had a nice flow going of how you doing, and then informed consent and x-ray and freezing, and here's the thing, and okay. And then they say, when can I come back? They're like, well, you have to get back to the back of the list, and then we'll work our way back through you, to see you next time, sort of thing. So we didn't have, it was basically like a walk-in clinic. It wasn't like a scheduled appointments to say, okay, we can fit you in next Tuesday at 10:30 type of thing. It was just working through this list of backlog of chief complaints and people. And so we would get them down by the unit and just work our way through.
That's impressive. Ours was a little bit mixed, and I think maybe ours was a little mixed because I was a dental student and they knew it was an educational experience for me. I think probably if I was a full-time dentist there, it would have been a different
Mm,
experience for me. So it was kind of them to allow me to sort of bring patients back to do some things and feel like, you know, not that you're building rapport with people because that's frowned upon there for sure.
mm.
But at least there was a little bit of continuity for me, which felt kind of cool.
Yeah.
That's really interesting. So if you're seeing 30 patients a patient, 30 patients a day, that sort of thing, you need to obviously have really good systems and be really efficient with what you have to work with. Like, what were some of the secrets to your success?
Well, it was just small things of doing multiple things at once, like uh, doing the info. the first, after the first peak to say we're doing something and it's here, freezing would go in. And at that time, of course, before that, we do a quick healthcare assessment, but we have their healthcare file with them uh, from the facility as well. And then just, informed consent x-ray. Okay, you're frozen now. Okay, here we go. And then we do the thing and then turn the room around and make the notes and on to the next one, sort of thing. So yeah, it was like you said, it was mostly an extraction clinic, although we certainly did our fair of fillings and used a lot of glass ionomer in some cases and that kind of thing. But I just got pretty good at looking at a tooth and knowing immediately how to get it out of there and stitch the person up and that sort of thing.
Yeah, it was pretty, I mean, for me at the time, because I was really, I mean, as a student, I had no secrets because I really didn't know anything.
Mm.
But it just felt like, to your point, how do you efficiently get somebody numb, do what you need to do? And I don't know. It was kind of interesting for us. So all of our assistants were also inmates. I don't know. Was that for you or would?
That was not the case for us. That's
Yeah. So
interesting.
yeah, that was interesting at first. They were inmates who had no history of violence or drugs.
Gotcha.
So what was kind of cool is it was a great place to work, right? If you were in prison and not everybody, but most people have a job or they're in getting some sort of education. So
Right.
it attracted people who were like, man, I want to be inside doing something,
Yeah.
where I
Right.
can, develop a skill. And so I think from a system standpoint, it was just maybe talking out loud with people who were curious and wanted to learn.
Yeah. Now, who took the x-rays in that situation then?
Um,
Remember?
they did,
They, they did,
but
eh?
they did, but I will tell you, there weren't a lot of x-rays taken.
Okay. Okay.
It was down and dirty and it was, and again, this is a long time ago, but the mindset was very much like, you're here to help people, but these are bad people who've done bad things.
Mm,
So that was
interesting.
that was where it was.
Yeah.
Wow. So if it's all right, I'd like to switch gears a little bit because it's a
Yeah.
different kind of dentistry with a different kind of skill set. So you went from the prison system to a mental health facility. And so that's a little different. I feel like those patients, whether they realize it or not, or they can help it or not, are probably almost harder to work on. But now all of a sudden, I would think medical history has become more important, what type of anesthetic you're using, pain medications, and all of the different any sort of any medication you might prescribe might be, you just have more considerations with this population. How
Mhm.
was that transition into that role?
Well, it's definitely a bit of a slower pace than working in the correctional facility. And I find that working at the mental health hospital, I really feel like I found a really great niche for me to work in because it really lends itself. I'm just very patient and very kind, and I never really impose on anyone that they have to do anything. So people with mental health challenges, they'll come in and and in this case, they're mostly inpatient. So we do have stuff on the schedule. And we say, okay, you're in for this and treatment today and things like that. But it's almost hyper permission based to say, hey, we've got you in for this. This was the plan. How are you feeling about that? Is there anything more important in your mouth that you'd rather I look at instead of this? And then is it okay if I lean the chair back? So every little tiny step of the way, it's a permission of, is it okay if I lean the chair back now? Hey, let me see how wide you can open. Okay, fantastic. And so it's a slower pace because of the patient care. And for me, I really find it's a nice way to practice. The side note that I think also lends itself well to that is at the mental health hospital, it's a per diem, and so there's no production or running a business or looking at billings or anything like that. So it can be caring for patients in its purest sense because all you're there to do is help. If somebody is booked in for 12 fillings and they just think I only wanted this little chip smoothed off, it's perfectly okay. Let's do that. We'll see you back next time when you're feeling better and up for it, things like that. So and every once in a while we have a patient scheduled for something and we get maybe 10% into it and they just at the moment they can't sit through it, and so we just reschedule, and that's also perfectly okay. We just have the nurses and the staff come and help them and that sort of thing. And then the other part of that, which is also quite interesting, is at the mental health hospital, there is a maximum security side to it for patients who, because of their mental challenges and illnesses, are a danger to themselves and society, sort of thing. So that's a different experience as well, because we have the community side patients, but the maximum security side, they come in with security, and sometimes they have some restraints and things like that. So we can care for them that way more safely.
Wow. So what prompted you? You've changed, like almost reinvented your career multiple times. So
Yeah.
what was it that prompted you to do that? And I mean, a lot of it takes some gumption too. So obviously there's people like, I can't take it anymore. And so they want to change their career. But it sounds like, at least looking back or, hearing you speak on this, you had some enjoyment along the way here. And it seems like you found a lot of positivity with these different roles. What prompted the change to, starting a private practice from scratch and then ultimately going into a really heavily restorative cosmetic type practice? I mean, it's an interesting path.
Yeah. Well, luckily, you're right in that I've seemed to have been fortunate enough to have been able to pursue things that I thought would be interesting and enjoyable. To be honest, my first private practice that I built from scratch, I didn't know what I was doing. And I was just, not that far out of school. And you think, well, dentists open up practices, so I guess I must be able to do that. And so I found a strip mall, and it was a bare bone. They just built the strip mall. So then architects and designers and build it out. And I still didn't know what I was doing. I knew some dentistry, but I unlocked the door. And of course, there's no patients booked. We open on the first day, but I didn't preemptively market the practice to fill the schedule up ahead of time or anything like that. So then I just grew that practice quite well and quite successfully, just learning and marketing and things like that. But that was a bit of a drive. That was a little over an hour each way for me. And so the opportunity for this other cosmetic practice and reconstructive practice came up closer to home. And so that was the transition to that one, where it was just 10 minutes from my house, and family growing up at the time and things like that. So it really cut down on the commute, allowed me to be home more. And it was when I had that practice that I had the idea for Tempstars. And again, I couldn't stop thinking about it. I thought maybe I could juggle the two things, but I really needed to know that if Tempstars made it, that's fantastic. But if it didn't, I didn't want to think that it didn't make it because I didn't have the time to give it the attention it needed to make it successful. So I wanted to make sure that it had every opportunity.
So I have a question. First, I really appreciate how humble you are and the humility that you have. It's difficult to excel at one thing. It's extraordinarily difficult to excel at many things. Do you, this is probably going to be a difficult question for someone like you who is so humble, but do you feel like there's a quality or two or three that maybe you have that if you're a dentist out there who's just getting started, like you should strive to have those qualities? Because there's something that unites all these things and the success factor that you've had.
I appreciate that, and thank you. I would say that most of the qualities that I've got that have allowed me to pursue the things with any semblance of success have just been this mantra of failing forward. I just have dogged determination and pick yourself back up and keep going. If there's something I want to do, nothing I ever do the first time is easy. I always expect the first time I do anything to be a complete disaster, and I just learn as much as I can from it, and know that there will be a second try and a third try and things like that. So certainly there's certain mantras maybe I follow. Like I really, for anything I do, I want to make sure that I at least know enough about that thing that I can have an intelligent conversation with anybody I might delegate it to. So that just relates to me to everything, whether it's my accountant. I have to know, like, I know a reasonable amount about accounting, so at least I can have good conversations. Even for Tempstars and our engineers and coders, I know full stack web development, not because I want to do it myself, but because I want to be able to talk to them and have good conversations about how the technology is progressing. And even for my dental practice, when a technician would have come in to fix something, I didn't fix anything myself, but I knew how all the equipment worked and how I could take things apart and things like that. So I had one of my mantras is this idea that you can delegate things, but you shouldn't abdicate things. And I stole that from Phil Gerber of the E-Myth Revisited, which is just a a long time Bible to me. But if you abdicate it, you say, I don't know anything about this. I hope you do. And I hope you get good results for me, versus delegating, saying, this thing needs to get done. This is my thought, my vision. This is how I think, and this is how we should progress through it. So I'm going to delegate it to you to do it, but let's keep in contact to make sure that it's going along successfully. Because I'm just a really avid learner, so I don't mind learning all of the things needed. I'm just a sponge when it comes to information and things like that. So maybe there'd be those things that I never expect to get it right the first time, but I'm just really perseverance and making sure that I'm pursuing something that I care so much about just kind of keeps me going and keeps me learning.
So what was it though? So you said this a couple of times that you were thinking about temp stars and you couldn't stop thinking about it. And so you finally decided to do something about it. At what point, like what was it that made you like go from thinking to doing? And what advice would you have to say another budding entrepreneur?
Well, for me, I've always been a technology person. I've always liked computers and things like that. And at the time, this was back in 2015, I hadn't even heard of Uber. So the idea of a digital connecting platform and what's called a two-sided marketplace business model, it was in its infancy at the time. There was some research papers about the psychology of the dynamics of it and things like that, but it wasn't really a known and established business model. And there was no other digital platform for connecting for temping. And so I just thought, well, there has to be something, because right now it's agencies or office hours only, and often they're not super pleasant to work with, and they're expensive and inconsistent and things like that. And I literally went to Staples and got pencils, and I just started drawing on grid paper some screens and what a button should do, and draw an arrow to this button, and what if it showed this, and that sort of thing. So it was just an idea that really gripped me, because I knew that not only I struggled with it, but all of the people that I know, all my dental colleagues, whether it be office owners and managers or dental hygienists and dental assistants and the other professionals that I work with and know, it just was a problem that I thought I really wanted to just summit that mountain. I really wanted to pursue it. So maybe if I was to distill it down, is if you're thinking of starting something and knowing how hard that journey is going to be, and knowing how many times you're going to have to dust yourself off and pick yourself back up, I would maybe one piece of advice would be to dig deep to make sure it is something you're genuinely passionate about. Because if you're thinking, I have a side hustle because this should be a better way to make money, it might be, but is that what's going to keep you getting up each time that you have a setback and things like that? So for me, it was just picking something that you just care so much about.
Great points.
And it was a problem back in 2015. I mean, geez, Louise. I mean, let's talk about the temping situation now. So I would imagine that your company's grown to something more than you maybe even imagined it would be back then.
Yeah, it certainly has. And before COVID hit, we were growing quite well. We had really taken off. And then when COVID hit, of course, offices started to, depending on the state and province, and shutting down and things like that. And I really knew that COVID was going the wayside. So rather than kind of think about shuttering, I took that time, which was kind of transactional downtime, to bolster up our customer support systems, our technology infrastructure, and things like that, in preparation to hit the ground running as COVID started going to the wayside. But it just threw a giant wrench in the marketplace dynamics of supply and demand. And we know they're cyclical. And I speak very often to graduating dental hygiene classes and dental assistants and dental study clubs and things like that. And it is one of those situations where things are quite, from a supply and demand standpoint, out of balance. But I think that there's still good navigating that can be done. And as long as, I don't know if you remember back in, maybe it was 15 years ago, there was, at least where I was, there was an oversupply of dental hygienists, that you'd need a dental hygienist, and 300 people would apply within 24 hours for this position, which was great. And I always paid people their professional salary, but there was some dental offices who might take advantage of that situation and really undercut the hourly rates to say, haha, you're lucky to have a job and I'll pay you this. And at least where I was, that maybe set up a little bit of a challenging dynamic. And so one of my messages when I'm speaking with dental professionals is, let's not engage, just understand that the job market is cyclical, and really be hesitant about chasing that next dollar, and really try to find a place where it feels like your work home, where you're respected and you can provide good patient care. I don't know if that answers the question about the temping market, but that's kind of the dynamic as it's been unfolding the last few years that I've noticed.
I think that's exactly what's going on right now. I mean, gosh, David, I mean, we talk all the time about finding your team, finding the kind of people that want to practice the way you want to practice. Hygienists looking for a practice where they feel valued and not necessarily finding where they're going to get $1 more an hour, but they're selling their soul in the meantime. So, I mean, this is definitely aligns with what we're seeing in the marketplace, wouldn't you say, David?
It absolutely does. And it makes me wonder, like, I know it's crazy where the time goes. I know we're like home stretching this thing here, but I have to ask you, so you've seen the marketplace go like a total 180 shift, and you're obviously somebody who studies and not crystal balls the future, but, sees things. I, it seems like we're still in for some hardship the next few years, but is there a turning point?
Well, I really feel inevitably there will be a turning point, because I don't know any specific initiatives that are getting executed on at the moment, but I do know that within the dental profession, it does seem like there is an effort to increase graduation capacity and increase availability of dental professionals, even just for access to patient care. Because some offices, if you can't find a good dental hygienist or dental assistant, you're scheduling people way further out than they should be scheduled out. So
Right.
I think that a dynamic like this has counter pressure to the point where efforts will be made to kind of bring things back towards the medium. Hopefully it doesn't swing too far the other way either, but I like to see a place where everybody is feeling like they just, without too much trouble, can, as a dental professional, you can find a place that feels like your work home and you belong and you're respected. But as a dental office owner and manager, you have the team you need to treat your patients and grow your practice. And it feels like we're still on that one side of the pendulum, but I think that there will be marketplace forces that kind of balance that back out. And even during COVID, schools weren't graduating people at the same pace that they even normally would. So there was a bit of a backlog from a graduation standpoint too. But no, I don't think I would say for sure there's light at the end of the tunnel, but to pin it down to when that'll happen, probably not this year, but maybe into next year or the year after.
Yeah. No, helpful. Pam, I don't know. I feel like this ages us because time moves so quickly when we spend time together with great people. But
It's so true. And this was fun and this was super interesting and so many things to talk about in such a short period of time. And thank you so much for
yeah,
sharing all of it. I mean, gosh, it was really, really cool. What a cool career you've had. And I can't wait to see what's next for you.
Well, thanks. I'm flattered and thrilled to have been invited and have a chance to talk to you guys. So yeah, I really appreciate it.
Well, thank you so much. The honor's certainly ours. So,
yeah.
everybody, for Dentistry Unmasked, we will see you next week. Have a good one.
Bye, everybody.
See you later.
Thank you, everyone, for watching or listening to the show this week. And thanks to our guests and sponsors on this episode.
Please check out our social media at Dr. Pamela_Maragliano and at Dental Economics Official.
Or you can check me out at igniteDDS or at Dr. David Rice.
And go to dentaleconomics.com to receive dental economics. You can choose to receive DE in print or digitally, and you can also get the details of our Principles of Practice Management conference on our website.
If you have topics or guests or anything you'd like to talk about on the show, send us an email to dentistryunmaskedpodcast@gmail.com, and we will do our very best to make it happen. Thanks again, and we'll see you next week.